The guiding principle and the inspiration behind all this collaborative works have been the divine dictum, Paropakaratham Yidam Shariram. Many speakers earlier also mentioned about this beautiful dictum Swami gave us and the purpose to the researcher's life, especially in our university. The objectives of this session are going to be, briefly is going to be like this, to present some of the projects which are done with the collaboration of super specialty hospitals, and to present a list of useful projects suggested by the doctors and the IT managers of the super hospitals. And finally, dwell some time on Insights project, a multimodal research platform that we are planning to build. As a first introduction, let me begin with a very humble app that we did way back in 2017. It's called Awaz. Basically, the announcement for blood group was being done manually. The ongoing soothing bhajans will be stopped, and then the announcement will be made, and then you resume. And at times there'll be so much rush that managers have to leave their work aside and then run to the station to make the assignment, to make the announcement. So the help of a student and guidance from the engineer at hospital, a manager from the hospital, and some of us here undertook this, and it was made almost 100% automatic. The announcements could be made from a cell phone from anywhere. Suppose the manager is there in his office, he can just choose what announcement to be made and click it, and the announcement will be done. It was very useful. This could be used in many hospitals where you need this kind of requirement. Recently, we have completed also automatic data transfer app. Again, this backs up the MedDreams data to Google Cloud for reliable storage. Python libraries for Win32.com, and also the Google Oath interface, which provides the API to Google Drive, was used to accomplish this. It has even accompanying simple software with which you can do bulk transfer. So it's very useful, currently being used. And these are 4 other contributions from MCA students from Nandigiri campus with IT managers at Super Specialty Whitefield campus, EchoSci, mPrescribe, Sandesh. These 3 apps, as you see, EchoSci captures and stores the echocardiograms for later review. mPrescribe is a bedside app helpful to the doctors at real time, and it actually reduces the medication errors. Sandesh sends out critical report lab results and alerts them in real time. Almost 10 years they are used from the time they are inducted. Around 2015 they were deployed. Caron Predict is a research endeavor, a ML-based prediction for predicting whether a patient should go for angioplasty or should go for the bypass. And I would like to know whether, wanted to find out from your colleagues whether it is really published. Otherwise, it is a nice thing to publish. As a faculty and researcher, immediately our attention is whether we can publish. But it has got a great implication. This can be part of the Insights project that we are planning to commence in a full-fledged way. Then PowerTask is another tool, again was used at Whitefield campus. This is actually makes use of PowerShell environment, which automates certain tasks. Here is a sample screen This is for system admins. You can monitor things like, you can handle things like user management or printer management, also monitor disk space, monitor event logs, things like that. Again, centrally, you can do this across all the computers located at various departments in the sprawling campus of the hospital. This is again, data-driven app for detection of urinary tract infection. Dr. Pradeep is going to dwell on this. I mean, he's going to come after me. I will not steal the shine from this topic. I'll leave the suspense for him to take up. Now, see, those are the apps that I have introduced, which basically showcase the full stack development capabilities with the faculty and the students by way of their project. They can do such things. Now, I'll present few samples about the research publications, which we have done in the past. Segmentation of and classification of CT renal images using deep networks, using deep neural network. Initially, the mask for the kidney was found. Then we applied a standard classical algorithm for segmentation. So this hybrid approach actually gave us a paper. And here is again a nice work by Dr. N. Uday Kiran and his team. Automatic segmentation of white matter hyperintensities, the brain, and they could even come up with the distribution of the same, which is useful for longitudinal study. Actually, lack of time, I have not put few more slides. Dr. Uday's team also has come up with the reconstruction of left ventricle segmentation reconstruction. And it can actually give computationally, it can give the movement of the left ventricle wall, which can be used for early detection of cardiac-based diseases. Deep learning-based detection of urethral stricture, this we again got inspired by Dr. Ashwin Sekhar. This is archived and to be is communicated. This is again helps in classifying the stricture and also tells what type of stricture it is, where it is located, and an interesting study, research study. Yeah, this morning there was a mention of this work, PhD by Subramanian. I was lucky to be part of this. This work led to his PhD. All the 3 samples are mentioned here about cardiogenic brain abscess, PTMC outcome, recurrent lumbar disc herniation, they mentioned. But what I would like to mention is about the interpretable machine learning framework that we adopted in a very concise and easy way. I have presented it here. The first step is the classification task where you identify a particular condition. Then we perform step 2 and 3, which are doctor-centric. Means it is important that we provide confidence to the doctors. We do the confidence analysis to tell how good is the result, to what extent you can lay your confidence in it. And also we provide model interpretability using various tools. SHAP is the one we have used in the thesis of Subramaniam. And it provides why particular characteristics or variables are chosen. And finally, we perform a very important crucial step, the 4th step, where we try to associate the non-invasive parameters with invasive parameters at time, so that we come up with a protocol which can be deployed. So with good amount of data, the ethics committee approval, all that we have accomplished this. This needs to be further developed into an app. Yeah. So basically this summarizes about the app development and also the research work. There's a few samples I have presented which showcases the strength of this collaboration. But now, looking ahead, what should be done? In bits and pieces from several departments, works might have been done, but it's time for us to stop here and take a stock of the situation and see how we can consolidate the work to move ahead. Knowledge from action, as many uh, in many talks in the morning, they were presenting how important it is, our data. This is all about capturing the experience and the data. Even experience becomes data by way of, let's say, prescription or a video of performing a particular surgery. Interpretation of the echocardiogram or radiology, radio film, so on and so forth. That needs to be retained. It's very, very important for us. The next thing is knowledge for action, planning and organizing it in a way, the data should be organized in a way that it becomes useful, amenable for applying AI or ML techniques. That is next important thing. And finally, knowledge in action, adapting it in the present as a protocol, maybe in the clinical room while dealing with a patient. So towards that, we endeavor to get on with this Insights project, which was mentioned in the morning. This project basically has several layers, which takes care of not only capturing the knowledge and storing it, but also refining it and keeping it in a way that can be used, and also provides services for research benefit. Like some of the speakers were mentioning in the morning session that for a precision insight, one needs to really capture the whole aspect of the patient, his environment, his lifestyle, his history, so on and so forth. But typically, when it comes to the doctor, immediately what he sees is the tip of the iceberg, based on which more of a reactive prescription. But if it has to be proactive, one needs to worry about the data that is depicted as the iceberg, which is below the water level. Now, that is very important because various opportunities like digital twins or virtual health monitoring or digital clinical trials, so on and so forth, they will benefit extremely from this kind of environment or a platform. And they need time and again interaction from several multimodal aspects like omics or biosensors and wearable sensors, so on and so forth. Now, as part of this Insights project, these are the various things that happen. A top layer at the infrastructure layer, we will try to create the next level digital health-based principles drive this. We have to capture their IDs, maybe ABA IDs. Consider cases. For a sample case is presented here. Patients admitted to spinal surgery, but you want to follow up with telemedicine, right? This actually brings about the kind of apps required for care continuum, as was dealt about in yesterday's session. Then we create data ingestion pipeline, which marshals the data and then normalizes, like the earlier speaker was mentioning. The big challenges are going to be the way that data is formatted and stored and standardized following certain standard. And we try to follow the international standards to make sure that these things are taken care of. So we'll create a warehouse infrastructure as part of the project. We endeavor to do that with clinical records, laboratory reports, different image data, different types of image data, so on and so forth, which should finally help in achieving AI-related tasks such as natural language. Like it is said now that the next most important programming language is going to be English, right? That's where the world is reaching. So we should be able to provide such conversational AI tools for this as part of this project. Then, of course, data privacy and personal data protection, all these things are going to become very, very important. This is the full master plan technology readiness level, going up to levels 9. First two levels are more or less achieved with data available online and some infrastructure related tasks have been completed. In this regard, some students of SSIHL and faculty from SSIHL, doctors from super specialty hospital and some industry experts have come together to promote these internships. We hope that as part of these internships, we'll be able to achieve a good level of progress in this Insights project. These are the collaborators briefly present before you. Especially, I should thank Manish Sharma and his team for giving us the opportunity for internships and really training the students well so that we achieve the full stack development through which we can realize our dream of, publishing a research paper is one thing, but seeing it in action in a clinical trial is the biggest satisfaction that any researcher would like to have. And by Swami's grace, we have that great opportunity here, and we are truly indebted to super specialty hospitals for that. I think lack of time, I'll stop here, but these are somewhat very readily available projects that students can take up. In fact, I have a big list of project statements given by the managers of super specialty hospital. Thankful to them. Yeah, SDG 3 is already mentioned. So I will stop here, offer this as a flower at the lotus feet of Swami for the centenary celebrations. Thank you, Saira.
Thank you, Dr. Sharma, for showing us how academia and clinical care can unite for a healthier tomorrow. Up next, Dr.